Hello, everyone, and welcome to episode 8 of LabGab. I'm David Avery, and I'm really pleased to have my friend and colleague Peter Pizzi join me today. Peter is a very accomplished technician and educator. I think possibly the best educator we have in the fixed aesthetic space in dentistry. Yes, I will overflatter Peter, but yeah, he is a tremendously gifted person as well as a great guy. And I'm so pleased to have you here today. I really appreciate you taking the time from your crazy busy schedule because you, of course, have a laboratory with a team back at the lab that's still pounding away today. And all of the editorial work you're doing as editor in chief of IDT and speaking and doing webinars and all those things that you and I both share a passion for. I'm so happy that you could join us today, and I appreciate you being here.
Thank you, David. Actually, it's a pleasure to be with you, and I appreciate all the kind words. And I hope you don't mind my environment. This is actually my office music room in my home. My laboratory was very busy and loud today, and this is the only quiet space I have. So I do a lot of webinars and things from here these days. It's my only quiet space when I'm not turning the other direction.
I understand, and it's nice to have that. Nice to have that area to get away to, the cave, if you will.
Yeah, my man cave, sure.
Want to remember to thank SS White for sponsoring this endeavor, and as we've had a nice series now, we've had 7 people precede Peter that I think are instrumental to our industry and contribute a great deal. And I thought we'd chat with Peter a little bit today. I find that he is really an interesting person to have on because of the fact that he is so heavily involved in publishing as editor-in-chief at IDT. He sees so much information come across his computer screen every day when it comes to articles that are being presented and technology's evolution and all those things that are swirling around us today, really at light speed. So Peter, thank you for joining us. And I'd love to hear what's on your mind. Why don't you chat a little bit about what you think is really important to us?
Well, thank you. I appreciate everything you're saying. And thank you to SS White for sponsoring this and supporting us here. I think the importance of companies behind the education and events like this to me are kind of the most important thing. I can tell you personally, I always try to work with companies that aren't just about a product, that are really about partially the education process. And that's really important to me. So thank you for them for sponsoring this to us. And yes, as the editor-in-chief of IDT, I do see a lot of information that comes through, and I appreciate it. And I also solicit a lot, right? I'm constantly pushing people to write. You know, I could tell you in truth, David, I think over the years of teaching and evolving, you know, the more you teach, the more you start to realize your flaws, your own flaws, right? And the more you learn. I can't tell you how many laboratories I've been in around the world or how many clinical settings around the world that I've been involved in that I come home with just as much as I've shared and sometimes more. And I think that's kind of a great attribute for our profession. So encouraging people, I think, has been my passion for the last 10, 15 years, and really raising the levels of our standard in our profession. So I guess my epitaph would be hopefully I made a mark and improved the profession as compared to the way I found it maybe 15, 20 years ago when I started.
Outstanding. So with all the things that are happening in technology today, I think you and I both share the understanding that the clinical laboratory dynamic has improved tremendously in this era of technical evolution, especially when it comes to communication and digital technology. So why don't you share a little bit about your feelings there and some of the things that you're working on?
Yeah, you know, I think it's interesting because I don't want to say I think you and I and probably lots of other people in this profession have been somewhat at the forefront of what's happening with us digitally, right? Behind the scenes, I know I was working with digital scanning before people knew it existed, right? I had the luxury of working with some of the companies as they were developing behind the scenes. And it's funny because as I travel around the world, and not as much the last year or two, but as I normally travel around the world, most people think of me as ceramics guy. And to be honest with you, I don't know if that's a fair title because I think I grew up as a technician. I feel really versed in a lot of different areas, and I'm master of none, but I enjoy them all, and there's always different aspects to it. But the one that kind of people always seem to think that I'm not involved in is the digital world. So let me clarify that a little bit by saying I'm a 6-person laboratory here in New York. In my 6-person laboratory, counting myself as the 6th person, my team is a fabulous team, and that's Jennifer and Helen and Abraham and Keon and Shane. They're really a great group of people, and I couldn't do what I do without them and their support. But also, I wanted to make it clear that in that 6-person environment, I have 2 milling machines, I have 2 scanners, I have printers, I have all the technology. I mean, think about that from a 6-person lab, right? I have 2 of everything, and things that probably aren't even out on the market yet officially. So my point is, we're very digital. At the same time, I really believe in the artistic process. And I think my goal has been combining those. Do I still think casting is valuable? Yeah, there's still valuable aspects to casting metal and ceramics as compared to sintering metal and then putting ceramics. Both of them have their places. Our job, I think, as educators and as technicians who work behind the bench, is really to know our options, know what we need and when we need it. And if there is one fight that I'm constantly fighting for, it's to not give in to it can only be this way or it can only be that way. Best example I can give you that, David, is the thing I hear the most around the world today, I'll just say around the country, the thing I hear the most is, well, we can't find ceramists, or we can't find good denture people, or we can't find this. And I said, well, that's kind of true. I get it. We're a slightly limited workforce and don't have as many people coming in. And we can address that issue separately in a minute. But here's the challenge that I have. When the last person you hired, who now technically runs your digital department, did they walk into your office with the digital DNA that they knew how to sit behind a computer and design teeth in software? And the answer is no, they didn't. You taught them that. And the frustration that I face is what you're really telling me when I hear no's, because no is just a kind of the thing I always back away from. I want yes people. I want everybody who could say, yeah, how do I achieve this? So back to that concept, you're not teaching them how to be ceramists. You're not teaching them how to be waxers. You're not teaching them how to be those things. And my argument is you should teach them that first and then move them into digital designs and any other technical environment that you can. But it's really what we're doing. And I think that's kind of the mistake that I'd argue we're making, is we're losing sight of our process for the production of profit rather than really looking at the big picture.
Yeah, we totally agree there. In my tenure at Drake Laboratory, the last 10 years I spent there, I was responsible for education and training, not only in that laboratory, but also in the clinical space with doctors and assistants, with a great deal of emphasis placed on educating assistants. But I'm a firm believer, as a technician first, as you just spoke, that you have to have a tactile sense of creating something in your hands before you can go to a 2-dimensional screen. Everybody wants to call it 3D, but unless you put on glasses and it comes out of the screen, it's really not 3D. We can spin it around and look at it, but it's not the same. And so I'm a firm believer that if people are going to be digital denture designers, if they're going to be designing full contour or substrates, whatever they're doing, they have to have created that with their own hands so that they truly understand what they're doing. And there's a tactile connection between their fingers and their mind. And I firsthand have experienced that over and over again, of training people, at least in the basics, to basic level of development before they get in front of a computer. And not only are they more efficient, but their quality is significantly better. So we're definitely on the same page there.
And in the big picture, you're more viable, right? And that's another challenge for me. And I talk about this a lot in lectures these days, is what's the viability of the technician? We want people in our profession. We want to encourage them and show them all the great in our profession. And there is a lot of great. And there's flaws, like every profession. No profession is perfect at any way. But I think the challenge is I want technicians that I'm educating, and even the clinicians that I'm educating, because I'm really on both sides of the aisle these days, I want them to be viable. And viable to me means that they have enough resilience and knowledge that they can handle whatever situation is in front of them. And to do that, I think it's really about the learning capabilities. It's not about the race to the bottom, how fast, how cheap, how hard, which I'd make the argument, and I guess I throw some of the companies under the bus a little bit that are only looking for, the same common trait, right? How fast can you make it? How strong is it? And how price wise can I be conscious to the industry? And gee, that's not a market I want to be in. And it's a market that I've kind of fought against a long time. With that said, though, I always like to be really clear. I do monolithic restorations. I do all different sorts of materials. I do everything. The challenge is I like to think that I'm sharing, and hopefully I have an understanding of the what, when, where, and why I should be doing those materials, not just because it's the one that I know.
Exactly. Many, many years ago, as we were coming through the evolution of ceramics, from stacked feldspathic into pressed ceramic and sintered ceramics and all these different things that have become available to us. At one time, as you well know, we had this myriad of choices. We had 6 or 7 different ceramic restorations that we could produce. And I really developed a program to teach not only my clients, but dentists throughout the country when to use what. And fortunately, it's gotten a little simpler now because we're not doing Optech and we're not doing lots of those other types of materials that we were using. But at the same time, dentists really understanding when to do what has always been my biggest challenge as a laboratory communicator with the clinical space, is that they become influenced by a clinician that is on podium or in print, who is, let's just say, in partnership with a manufacturer and has that manufacturer's best interest for promotion in hand. And there's certainly nothing wrong with that. I mean, you and I both have relationships in manufacturing, but at the same time, if all you've got is a hammer, everything's a nail. And that's what we face as technicians. We have dentists asking us every day to use a certain material for restoration when it's not the best indication, based on what's underlying color, strength, aesthetic values, and all those other things. And it tends to get oversimplified in the clinical space, whereas we totally understand from remaking things that didn't perform aesthetically as well as they needed to or functionally. So I know you do a wonderful job of bringing clarity to that space.
Well, I try, and I think it's a challenging space. And look, I'm with you. I think, clinicians, especially today, I think are very well versed in what the companies want them to be versed in. And part of our challenge is really making sure that there's an understanding of the where and why, which is, again, kudos to SS White and all the companies who are supportive of these opportunities for us to really talk about the educational process, because it really is the key. It really is the difference that will make a new technician or a new dentist come in. By the way, it's on both sides, right? I see it in school. I'm faculty at NYU, and I work with a lot of students who are going through the schooling process, but I also have post-grads who come back and stay with us for aesthetic programs for 1 or 2 years now. And it's interesting to watch their take and how much more learning they need in the sense of what they got through 4 or 6 years of dental school that didn't give them all the backgrounds and all the, it's funny. I push dentists into courses a lot of times and they say, well, I just went through 4 years of dental school and 2 years of a specialty program and a residency program. And you're telling me I need to go take more education? And I'm like, yeah, because you didn't get enough. And I make the same argument to the technicians, right? You worked in a lab for 3 years, but did you evolve? Did we grow? Did we get to have a bigger vision of what we can and what our future should be? And I think that's always the key. And that's probably why I struggle so much in lectures. I think, like you, David, we both have that verbal diarrhea thing where we could talk for hours and keep going and going. So it's probably one of our flaws. But at the same time, I think I talk so passionately about it is because I believe in it. And I believe I want my profession to be better. I mentioned before about the viability, and I could tell you, and I think you're aware of this, we probably had this conversation privately, but as I was going to shows, and I'll just focus on the US right now, as I was going to shows around the United States for the last 15 years teaching, I noticed that everywhere I went, I saw the same faces over and over again, right? And I'm sure, like you, picture being on that plane, and I'm flying to a state in our country, and I spent my 3-hour plane ride or 6-hour plane ride building a lecture for that day. And I'm putting all these new thoughts in, and I want to show this case, and this case is great because of this, and I can't wait to get there. And then I walk into a room and I see nothing but 70-year-old dental technicians who have seen me 9,000 times, and no knock to ageism, so I'm getting up there too. But my point is, I have to sit back and say, maybe this isn't the case I should be showing today. Maybe I have to think about, how do I motivate that person? And how come I don't see any 20-year-olds in here, or 25-year-olds? So when that happened to me, I revamped my thought process. And what I wound up doing, there's only 10 schools left, by the way, but now, years ago, there was about 15. I made it mandatory that every state that I went to that had a dental school, technician school, I would donate a day to. So if I was flying into California as an example, I would go twice, 2 days early, right? Because it's 2 schools, and I would work one day in one school and one day in the next school, and then go to the show and do my show thing. And I've done that throughout the country now for the last 7-8 years, and I'm actually encouraging more people to do that. But the advantage of that was, now when I go to those same shows, I still see my age group there, right? Maybe a little older, a little younger, but I also see an influx of younger people. And I think that's really where the motivational part comes from me, is we need to inspire people to see the value of what we do. Because what we do is we touch human lives every day. We make people feel better, healthier, look better, and raise their confidence. And we don't get enough of hearing about that. What we always get the feeling of is what we did wrong, but we don't get enough of the value of what we give. And I think to have that value and give it, we have to have a stronger base to work our process from.
Those are both wonderful points. And my consulting with laboratories, and in my teaching technicians, and in my management of Drake during the time that I was there, it was very important to me to relate to technicians that we're not working for the dentist. And that pan that has inanimate objects of gypsum and ceramic and denture teeth or whatever's in that pan is directly connected rather to a human being. And I find that that's one of the most powerful things that we can share with developing technicians and even journeyman technicians is, we're in the weeds and we're dealing with what we didn't get from the dentist that we needed, and how this prep isn't adequate, and they're asking for things that we can't do based on what we've received. And we really have to try to get beyond that and remember that we really are treating human beings.
Well, we're a healthcare profession, right? And that pan that we just talked about is your mom or your dad or your brother,
exactly.
Your sister. And I think that's where the flaw comes in, especially with product and process, right? Because product and process is really all about the product's strengths and the process of how you get there. And there's nothing wrong with that. We need that information. Of course we do. At the same time, that product and process has to fit your mom or your sister or your brother or your daughter or son, right? And that's where I think we kind of lose sight of. I can't tell you how many lectures on the clinical side that I've started. And as a sarcastic New Yorker, I start by saying, we're in the healthcare profession, right? Because everybody's so evolved with the product and process point that they sometimes forget what our real job is. And that's about taking care of other humans.
Exactly. Yeah, and I also appreciated your comment earlier regarding education of clinicians. And I've spent a great deal of my career working with assistants, and I know you do as well. As dentistry is evolving and becoming more and more entrepreneurial and more fiscally motivated, and I speak as a geezer now because I've been doing this for a long time. And I remember in the beginning when dentists became dentists because they wanted to treat people. And we're not nearly as focused on that, I think, in dentistry as we wish we were. But I've spent a tremendous amount of time and energy educating dental assistants because today, with expanded duties, they're doing a significantly larger amount of the work that directly affects our success. And so I think that's something that we all need to be thinking more about. And I appreciated your comment about when you're visiting an area, one of the few areas remaining that has a school, you're committing time to that school. And you've just changed my thought process today. I'm definitely going to start emphasizing that and really trying to be more impactful for the very reason you stated, and that is we need to help them understand the value of continuing education, and especially collaborative.
Yeah, and let's be honest. I mean, we have a good insight on our profession, but there is no school system, whether it's veterinary or obstetrician or you name it. I would argue that there is no perfect schooling environment that produces perfect people when they're done, right? And if that's the case, then our field is no different. Our profession is no different. And I think our educators in the school systems, whether it's in an NYU or UCLA or a technical college, also need to revamp and readjust to our changing world and our changing environment. And sometimes I think without having influence of what's happening around the profession, it makes it harder for them to do that. And the more that and it's funny, something we're talking about now with IDT, so inside dentistry, where I'm really trying to harness that. Obviously, I've encouraged my friends over the last few years to spend more time stopping in and out of these schools, but it's getting to the point where it's not happening enough. So one of the things I think we're going to address, hopefully in the magazine, will be exactly that, is how do we actually start making a group of people who can kind of go and bring in a new message. Because look, you and I walk into a technical college or a dentistry school, by the way, because understand I teach on both sides, right? So I'm in the pros program in one place, and then 3 weeks later I'm in a technical college for technicians. So I'm in both parts of the spectrum, and my job is to motivate and show the value of both. But I think it's a little harder in the technology world because from the older mindset of what technology was, it was more people on our age and maybe a little bit older who knew something and kind of stuck to what they knew. Where we don't have that opportunity today. We have to keep evolving what we know. We're only as good as we were 3 months ago, and I want to be improving on that. But also I want to show the difference. And here's the difference. I mean, take you and I as examples. I didn't think that I would have seen the world. I didn't think that I would meet all the patients I've met. I didn't think that I'd meet all the people that I've met in this wonderful profession. And I have. Why? Because I'm not just sitting only at a bench, just figuring out how to polish that denture tooth, right? I'm trying to see the whole vastness of this industry and this profession. I don't like the word industry. And I think to do that, we have to influence the people coming into the profession to see more. And on the other side of that coin, I'm being long-winded as usual. I think there are a lot of people that are changing that. There's a lot of the younger faces today that there's more dental educators, both on the clinical and laboratory side, than there's ever been. There's more groups that have been established. So as much as the basic environment has its flaws, I'm also seeing the uprising. And I'm seeing it with, I'll give you one more example and then I'll shut up for a minute. I teach in NYU, and I could tell you I have a waiting list of 18 dentists right now who are trying to get into my program for next year. Okay, 18 dentists. And by the way, these aren't dentists who just got out of school. These are established dentists from all around the world who have practices and families and everything. And they're trying to give that up to come and spend a year or 2 years in my NYU program. Think about that. Now, why are they doing that? Because they want to be better, right? And that number is growing every year. We're at 18 right now, and we don't open again until August for this program, right? We're in the middle of it right now. My point is, every year, I'm shocked that more and more people see the value of our program and are trying to give up their life and give up their practice and their life and come move here for a year just to work with us. And to me, that's a positive sign, right? That's a sign that where things are improving. As much as there's always a negative, there's a lot of positives that we have to grab onto.
That is very encouraging. It's been really my MO for most of my career as an educator, just to speak about my process in this space. Working with different manufacturers over the years, I realized very early on that we're guilty of having compartmentalized education. And that is the assistants are in one room, the technicians are in another, and the dentist is in yet another. And nobody's collaborating and sharing anything. So on Monday, when they go back to their respective locations to treat patients and do their thing, nothing changes.
It's the
Very,
floor
very
of
small,
Chicago,
very
right, David?
small thing.
We go to Chicago every year, and you have all the dentists on one side of Chicago and all the technicians on the other side of the Chicago. And I always joke there's a glass wall in between that we
Right.
have no breaking, right? And I think, again, as you know, I've spent years trying to break that and encourage technicians and dentists to learn together, because that's the only way. We need each other. We're desperate for each other's acceptance, and we're desperate for each other's knowledge and growth. And I think it's a real important part of the future of our profession.
Yeah,
But
because we're really trying to impact change. You know, we really are.
yeah, the but I'll put in there, and I don't like the word but either sometimes, but the but I'll put in there is we have to raise our level as technicians, right? In other words, if I want to be equal to my dentist partner, I have to understand the clinical side of dentistry. I have to be able to talk to my dentist about managing the tissue. And you know, doctor, that's a bio 1, very thin tissue. I'd rather you don't go too super gingival, because we're not going to get that tissue growth back, or we could violate biological width. I want to be on that same page clinically with my doctor, and I want them to be on the same page with me technology wise, right? I want them to understand you provided 0.4 of a millimeter, but you want to change 4 shade scales. Not going to happen. And I think that's where the teamwork really comes in.
Absolutely. And yeah, in my journey too, with various manufacturers, I've always really done everything I could to encourage them to do collaborative education and to develop programs and invite audiences of especially assistants and dentists and hopefully technicians as well in the same room at the same time. Because as I said earlier, that way, whenever we do teach concept and it's something that they find of value, when they go back to their respective locations, they actually embrace that and we do affect change. And I know you've done a wonderful job in that space of collaborating with clinicians to teach. And it's when I have the most fun. There's no question about it. It's when we're partnered with a clinician and we're teaching both at the same time.
That's our value. So I hope I'm not going too long. Maybe this is going to be a 2-parter rather than because we both have that talking too much concept.
Well, I think it's good to exchange. And, you know, we both have that personality, and I don't have a problem with that. I hope our audience doesn't as well.
Well,
I really appreciate. Go ahead, please.
No, I was just gonna say I appreciate, you know, spending some time with you. We don't get to see each other often, so thank you for having me here. And we could talk more, or you could bring me back, or anything I could do that's helpful in any way. My answer is yes, right? So it's always a simple yes answer to figure out what we could do to keep improving our profession, to keep improving the people in it, and in the end benefit, you know, somebody's mom, dad, brother, sister, and uncle whose cases we're working on, and building practices, right? Because I think that's part of our process. Is the better we are in the technical world and the better we are behind the scenes with some of our clinicians, the better their practices are. And I think that's another misnomer that you know, we support them being better and growing their businesses, which is what supports our businesses.
Well, absolutely. You know, sharing is self-serving in a large regard, but it's nice to see the light come on, you know, and I know we both enjoy that. Peter, I really want to thank you for taking the time today. I know how busy you are. Our audience needs to understand that you were up late last night and you have a long weekend in front of you, because you're still very active as a technician and producing dentistry. And I really admire you for your energy and your commitment to our industry.
Thank you very much. I appreciate that. And it's an honor to spend some time with you. So thank you for inviting me. Anything I could do to help or give back, you always can count on me. And I appreciate that. And thank you to SS White for supporting you and me in this venture right now.
Absolutely. Peter, thank you so much. And at the end of this webcast, you'll see an offer from SS White for some great deals on some excellent product and technology. So thank you, Peter, and good day.
Take care, Dave. Thank you very much. Thank you, everybody. Bye-bye.
Bye-bye.